Hi everyone, thanks for joining us. Today is Monday, September 28th, 2020, and I'm Dr. Wendy Fortna here with a little bit of a COVID update. Today is beautiful weather, probably the last day of real summer that we're going to get, and that means that a lot more of us are going to be indoors, probably coming less than 6 feet from strangers, so all the questions I got this week about proper mask wearing could not be better timed. I'll start off by telling you that if you've been paying attention to the news, our community of special areas, number 2, does not have any active COVID cases, nor do we have any cases in our school system. So we're very, very lucky compared to some of our counterparts in urban centers that are struggling right now with high caseloads of COVID. So all of your staff here at the Hanna Medical Clinic are healthy and at work, and our hospital is operating at full capacity. Most of the questions I had this week were around cohorts and masks. So I'm going to start with a little bit of the cohort clarification. So for our intents and purposes, we're going to say that a primary cohort is what we started off with last April when they said, don't leave your family, don't talk to anybody, don't touch anybody. So this is going to be the immediate nuclear family. This is going to be mom and dad or whatever parents we have in the household and the children. That has been extended to include 15 people now. These are people that we do not practice social distancing with, we do not have masks, and we're generally assuming that if one of us gets sick, we're all going to get sick. So that would typically include your immediate family and any others that you spend a lot of time with. It may include a grandma and grandpa, it may be 2 or 3 families that connect together and say we're going to vacation together, we are going to socialize closely together without precaution. That's my primary cohort. School has created another cohort for people, particularly if you have children in the K through 3 range where there is no masking, and we know darn well those children are not social distancing in the classroom or practicing anything close to good hygiene. And so they are going to be a close, I would call it secondary cohort. Each class will be their own cohort. We also have cohorts now with sporting teams. So a lot of places like our dance associations and our skating associations are trying very hard to keep people 6 feet apart and encourage them to wear masks. But depending on the age of the student, particularly the little ones, they may still be interacting with each other without masks and without social distancing, and therefore are considered a secondary cohort. You are right to be concerned, the idea that I might have my kid in a day home cohort, I might have another one in a kindergarten cohort, in a dancing cohort, in a football cohort. All of a sudden my world and my spider diagram that I can visualize is huge. It's important to keep track of these cohorts so that if we do have an infection in one, we're able to trace the contacts and make sure that everyone who is at risk is aware of it. If you or someone in your immediate primary cohort has a significant medical condition that would put them at increased risk of complications, you may want to be wary about how many cohorts you're a part of. It might be more important for you to say my primary cohort of 8 people is really all it's going to be. Many people in our seniors' homes are going to be like this. Of course, the nursing home is separate. It's an Alberta Health facility, but things like our local manors and lodges, people there tend to be more cautious about the size of their cohorts. People with children, it's not always possible. We're lucky here that often our school class cohort is going to be the same as our dance cohort and our hockey cohort. And so we're trying very hard to minimize the number of people we're having contact with. As I said, right now our primary cohort is limited to 15 people. And there's no limit on the number of secondary cohorts that your child can be a part of, but you have to be aware that the more cohorts they are a part of, the greater the chances of an infection in a distant person you may not even recognize may come to contact your family. So you'll just have to make some personal choices about where your values and health issues are. The next thing that came up was the idea of siblings again. So we really pushed last video about how if you are symptomatic as a staff member or a student, you should not be attending school. But what about your little brother who feels fine, has no fever? Can they go? Absolutely they can. So only the people with symptoms right now are restricted from attending activities or going out in public. If we have positive COVID cases, that changes things a little bit because contacts are restricted. If you answer any questionnaires right now in the medical clinic or the hospital or sporting event, it will say, have you come in contact with a suspected COVID case? So how do I answer that question, right? It's a little bit confusing. When we have taken a swab from someone who has one of the 5 cardinal symptoms, that does not imply that they are a suspected COVID case. It's much more likely, right here, that they are a common cold. That's because our underlying community rate of COVID right now is 0. If that changes, the likelihood that somebody who has a minor symptom such as a sore throat or a runny nose has COVID will go up significantly. But right now you can confidently answer no to those questions, even if you have a child at home with a runny nose waiting for a COVID swab. That child should still be in isolation until their swab results come back, but the remainder of the family can go about their normal activities. I was asked to specifically talk about how to wear a mask properly and how to store it. So what I've got right here is I've got a paper bag. You want to be storing your used masks in something that is not going to be airtight. The reason for that is there's moisture on these masks from our breathing, and they can get contaminated with bacteria, with mold. If we're doing that, we want airflow to be able to go around our mask. So before I put my mask on from my bag, I'm going to use my hand cleaner, or I'm going to wash my hands. This is to make sure that when I'm touching it, I'm not bringing anything that's on my hands onto my mask, or if there's something on the outside of the mask I've been using and storing in my bag, I'm not going to accidentally rub it on another part of the mask. So in my bag, I'm going to grab out my mask. In this case, it has 2 sides. I've got a blue side and a white side. Blue, I'm always going to remember, faces the outside world. You'll notice I'm touching it by the very edges, not by the part that's going to come in contact with my face. So when I put it on, it must cover my nose and my mouth. It's securely around my ears, so it's in a good position. Sometimes I'm able to twist the side of my mask to create a little bit more airflow for myself while still protecting people in front of me. Once I put my mask on, just in case it was contaminated when I put it on, I want to wash my hands again. Now, if I go and touch a doorknob, some groceries at the store, I know I'm not going to get anybody sick if there was contamination on the outside of my mask. When I'm ready to take it off, I clean my hands again, I take it off with my earpieces, and I'm going to want to make sure that the part that was touching my face is folded inward. So I grab the edges, I fold it inward so that the outside is on the outside, and I put it into my reusable bag. Now, as long as that mask isn't visibly wet or soiled, I can wear that mask again. If it's a reusable mask, I'm going to want to probably wash it every single day because you can't detect exactly what might be on it. Like I said, a paper bag is good for storing it, or a cloth bag with a drawstring on the top. We have a lot of those that the masks are actually sold in that come with the bag. Throwing it into my purse, probably not such a great idea. I can't really keep it folded properly. I've seen people hanging them on their rear view mirrors of their vehicle. If they're folded in half, it's really not a bad idea, especially if you are a single occupant vehicle. If you have 5 or 6 people or you have strangers in your vehicle, not a great idea, because if they cough or sneeze, it's going to get really dirty, that mask. But having one in your vehicle inside of a small compartment, not a bad idea at all. I think I'm going to pull up these questions here just to make sure I got to everything today. Okay, so we put it on, we removed it. What if I have to get some fresh air or a drink of water? Then you want to remove your mask and then put it on. Trying to eat with it dangling off of one ear is really difficult without getting the outside dirty and the inside. I know, practically, if we all wear masks all the time, the inside and the outside are really not dirty. But that's not the reality. A lot of people aren't wearing masks or aren't able to wear masks, although that group is much smaller than they may have you believe. Very few people cannot wear a mask. So can you use it again to go to the post office? Yes, you can. Just make sure that you're taking it on and off. You may want to keep some hand sanitizer in your vehicle for that purpose. I sometimes will just leave my mask on when I'm running errands so that I'm not trying to put it on and off in the middle of my activities. So it's easier to remember that way. Okay. Yeah, so mask hygiene, putting others at risk. Really, the point of wearing a mask to protect others is so that if we cough, sneeze, or breathe, our droplets are contained by our face. So even if we put a dirty mask on ourselves, it'll still protect others because I'm not able to get my breath or droplets onto other people while I'm wearing it. But if we're putting on a contaminated mask or putting it on improperly, I am going to be at risk of getting injured because of whatever might be on the outside of my mask at that time. It's kind of confusing, but most people I see are doing an okay job. There's always going to be a few people that I shake my head at in the grocery store who are wearing it right below their nose, and I'm thinking you're doing nothing to help yourself or anybody else right now. But I haven't figured out a polite way of telling those people yet, so I'll work on that. And I think that's all I have for this time. So I will see you again next time I have enough questions to make a video. Have a wonderful day.